How much more vital information are state leaders willing to keep from the public? Tonight we've learned a second inmate has died from COVID-19 inside Arizona's prisons. The Pinal County Medical Examiner's Office says the 79-year-old man who died Friday also had lung cancer. The ABC 15 investigators revealed the first death happened 2 weeks ago in Pima County, but officials still haven't said a thing. As you're about to see, and as ABC 15 investigator Dave Biskobing explains, keeping that information private endangers us all.
Inmate Joseph Asid died April 12th from COVID-19. Here's his online death notification. Nothing from ADC about the cause, and certainly nothing about coronavirus. The Pima Medical Examiner's Office confirming it was COVID-19, but also confirming it didn't do an autopsy.
So that's unusual from at least your experience.
It's unique in our experience. This is the only time I can remember.
To be clear, attorneys like the ACLU's David FAHTI, who have been locked in a healthcare lawsuit against ADC for 8 years, have never seen it before.
I cannot recall a single case where we had been told there is no medical examiner report because no autopsy was done.
And then there's this tweet, Representative Athena Selman telling us, lawmakers were told Friday by the department that there had been no deaths.
In Arizona, we've tested a woefully low number of inmates, less than 0.5%. It's almost like we can say we did a good job if we don't actually look at the job we've done.
FAHTI agrees. He compared it to an ostrich burying its head in the sand.
Seeing an almost ostrich-like level of denial that if we don't test people, then we can say, oh, well, we have no confirmed cases.
What we're projecting is that within, 3 weeks when we release the report, now about 2 weeks, almost everyone in Arizona's prisons could have the virus.
Felicity Rose is a policy director with Forward.us, a criminal justice reform organization. They released a model showing 99% of inmates could catch it. 3,100 staff, 360 total dead.
In Arizona prisons, where 90% of people are housed in dorms, so they don't even have cell walls between them, they're just in bunk beds. There's no ability to distance from people at all.
A projection with 99% of inmates getting infected seems hard to believe. But in Ohio, the state tested every inmate in one prison and found above 80% tested positive, most asymptomatic.
In one of those facilities in Marion County, Ohio, it has also led to an outbreak in the community because guards are taking that virus back and forth.
Arizona's Department of Corrections, with the backing of the governor, refuses to release the number of staff who have cases and what prisons they work in.
This is information that should be front and center in the public domain because we are really all in this together. If the prisoners have it today, staff will have it tomorrow, and people in the community will have it the day after that.
I'm investigator Dave Biskobing, ABC 15, Arizona.
Just before 5 o'clock, the Department of Corrections sent us a statement saying that all inmate deaths are investigated by the Medical Examiner's Office, which determines the cause and the manner of death. The department also saying, to date, we have not yet received such verification from the County Medical Examiner's Office. Once the cause and manner of death is officially provided to the department, the dashboard will reflect any deaths determined to be due to COVID-19.